I'd like to introduce myself. I'm Khalida Ismail. I'm a consultant psychiatrist. I have been working with people with diabetes for over 20 years. I am based at King's Health Partners, which is an umbrella for King's College Hospital, Guy's and St Thomas's Hospital, South London and Maudsley Hospital, and King's College London, the university. I'd just like to make two housekeeping points. Firstly, please can I remind you all to keep your mics muted and the video off, and therefore you will, through doing that, you will actually hear us better and see us better. And the second point is that we are inviting you to send questions and comments via the chat function, which you should find on the left-hand side or the right-hand side of your screen, depending on how your computer is set up. So please get your thinking hats on. We actually really do want to hear from you. We may not have time to answer all of your questions, but we want you to know that we will be reading them all and using them to inform how the future of these sessions develop. So I'd now like to welcome you to our team today. I'd like to first welcome Lis Warren. Lis, are you with us?
I'm with you. Hello.
Please, could you tell us a little bit about yourself?
Okay, I've been living with diabetes since 1965. Had my ups and downs, a lot of experience with psychology services and diabetes services, and I'm here today to try and share some of the experience that I've built up over those years.
Thank you. And now I'd like to welcome Rebecca Upsher, who is one of our PhD students and recently passed her PhD. So absolute congratulations, Rebecca. Tell us a little bit about yourself.
Hi everyone, can you hear me okay?
Yes.
Great, thanks Khalida. So I'm Becky Upsher. I work in the Diabetes Psychology Research Group at King's with Khalida. As Khalida said, I've recently passed my PhD.
Yeah.
And I've had type 1 diabetes for 10 years. But my PhD research is actually more around type 2 diabetes, and I was developing a intervention to help people with type 2 diabetes start insulin.
Thank you. And Emma, it's really great that you can join us. Would you tell us a little bit about yourself?
Yes, hi, my name is Emma Konstantara. I'm a PhD student at King's. My area of research is type 1 diabetes and eating disorders. And I work as part of a bigger research project, which is called STEADY, and it focuses on creating an intervention for people living with type 1 diabetes and eating disorders.
Brilliant, thank you. So I'll just give you an overview of how we're thinking of running the webinars and how we're going to do today's. Is that first, we're going to provide, the purpose of these webinars is to provide an online, interactive, live forum or space for people with diabetes from all walks of life and all types of diabetes to share your thoughts and feelings during this COVID-19 pandemic. Our second aim is to have discussions with you about the latest ideas on diabetes and mental health, both clinically and research, and actually some of these ideas are developed through and from people with diabetes, so this is why it's really important to get your thoughts. And then finally, we're hoping to share a toolkit that will keep building, a list of suggestions of where else you can go to get support for yourself and your loved ones. I'd like to emphasise that this is unfortunately not a clinical service. We will not be providing any clinical advice, but we are here to listen to you, share your experiences with the wider diabetes community, and think with you so we can develop, all of us, better ways of coping. If you do need urgent medical or mental health care, please contact your GP surgery, who will listen to your concerns and will try to help you. So the format will be is that we will interview, as a general rule, that we'll interview a patient and also a health professional for 5 or 10 minutes each. And then we will look at the questions that you've sent us and discuss these. Rebecca, and I'll hand over to Rebecca and Emma at that point. I can just please remind you that do not worry if we do not get to read your question out loud, because we are collecting them all and we will be sending a summary of these on our Twitter page at KCLDPsych to give others a chance to comment. Can I also just remind again, and sorry to keep repeating it, please don't forget to stay mute. Otherwise, we might hear all sorts about you that you don't want us to. And the chat function is on the right or the left-hand side of the screen. So I'm going to start now by asking Liz a few questions. Thank you so much, Liz, for joining us today, and also for helping us develop the ideas around this webinar. I'd like to start by just saying what you've already said, which is that you've had type 1 diabetes for 50 years. And as you put it, you've been through many trials and tribulations. And taking all of that into account, what has been your personal psychological experience of COVID-19 and having diabetes?
Well, the first thing that came to mind, of course, is will I get my insulin? So the basics, the absolute basics. But fortunately, because of Brexit and all the talking about that in the last year, I've done a lot of talking to people about, continuity of supply and all that sort of thing. But the fear I don't think we generally need to have, because certainly in my GP surgery, prescriptions and all that is all working very efficiently online and through email and so on. The next thing was when all the news started appearing. I have a sort of morbid fascination for it. I love watching it. And I sat there for hours and hours devouring it all. But then that, of course, makes you fearful. And then, very soon after that, a friend of mine with type 1 diabetes got what was suspected to be the virus. And then another friend very clearly had it. And I watched, their videos online about their story. And then two of my friends, my best friends in my street, got it, and one was taken to hospital. And I was terrified. I was really, really frightened and concerned for them. All of them are fine. All of them came through. But then I had a nightmare because, I woke up in the middle of the night kind of imagining that I couldn't breathe, and I was crawling along the floor trying to catch my breath because I'd seen this on the TV. So yes, lots of fears, a bit of reassurance because I know my meds will be there. I know there are people to go for, but it's certainly stoked up my concerns.
Sorry, I can't see you, Liz. I think what you're saying is so powerful, aren't you? You're saying that there are two aspects to your experience. One is that of the ordinary person who is probably having similar fears and possibly also very similar nightmares, but also there's the infusion with having diabetes, that there is your basic need for your insulin and worrying whether that would happen, but also whether you are more at risk. So it would be interesting to find out from the other people that are listening whether they've had very similar experiences of the nightmares, which sounded very vivid and very disturbing. Could I go on to build on what you've said, which is that as the government says and as the NHS says, that people with diabetes are one of the vulnerable groups. And thinking about the dream that you had, how have you handled your anxiety during this pandemic?
Well, what I've learned over decades of self-examination is that the only way to deal with fear is to actually face it and talk about it. So my long-suffering husband, who recently diagnosed with type 2 himself, listens to me talk an awful lot about my feelings. And online, I think the diabetes groups that are available and the friends I've made over, the recent 5 years or so since all these forums have been available online are just invaluable. So, there are lots of groups. I chat with other people who have got diabetes. And one of the big things that came up for me just when COVID was beginning, I actually had a conversation with my consultant at Imperial about being prepared, because I have a big fear of going into hospital. And that conversation was really, really helpful in getting me to start thinking carefully about what would happen to me if I were taken seriously ill and on a ventilator. And then I started to chat with the other people in my Diabetes UK medalist group on Facebook. So people who were all aged over 50. People all aged over 50 who'd had diabetes for a long time. And it really opened up a mini floodgate because we all had similar fears. So we started discussing what, because we've got diabetes, are the particular things we want to have in writing and ready should we ever get ill. And that actually applies to people of any age. But there's a big I think there's a huge, fear and suspicion about talking about death. But it's the one certainty in life. You know, even when you're a teenager, it could happen any minute. And it will happen to all of us. So why don't we prepare for it better? So I'm really looking into this in great detail now. And I've been watching webinars on advanced directives and things like that, and documenting my own care so that I don't have, end up being taken into hospital and things happening to me that I don't want. And then the other ways I have of dealing with anxieties are the absolute obvious ones that anyone would recommend, and that's exercise, walking. I love walking, enjoying the spring at the moment, and listening to music, and that's stuff that everybody can do. And even if you're stuck indoors, I've got a friend with type 1 who lives in inner London, and she watches exercise videos and dances and sings every day, and that is hugely enjoyable and really helps you deal with feeling anxious. And then finally, the other distraction that I use, because we all need distractions, and I've actually been watching a lot more TV than I usually do. So, I love things like Have I Got News for You and Would I Lie to You? And there's a series that I've got hooked on now, and I never used to do that before. But I'm getting huge relief from doing that. You can actually go to bed happy when you've been watching somebody really funny on TV.
I mean, Liz, you've just described a fantastic list of ways of coping with these difficult times, especially with your own internal fears. I think I really liked, if you don't mind me reflecting back what you've said, which is that you acknowledged how scared you were, and actually found, were able to ventilate that, describe that to your loved ones. You called him a long-suffering husband, but I think it's a normal relationship, using your normal relationships of the people that you care about and who care about you, and ventilating and telling them how you're feeling. That seemed to be really important to you. And I think I was quite touched by the fact that you've been having to think about, suddenly these ideas about dying, which we all know is going to happen, but we put it to the back of our minds because we don't really know when. I think COVID-19, together with having diabetes, has brought that a bit more in your face, is what you're saying, hasn't it?
Exactly, yeah.
Diabetes, you've always had a sense of perhaps my time might come earlier than perhaps the average one, and I perhaps have to think about my time a bit in a different way. And then COVID-19 has added on to that and made you think about advanced directives. I wonder what our younger community of people with diabetes think about that, whether that still feels a bit scary for them, whereas perhaps because you and I are of an older age, it's a bit easier for us to think about that. And then I was really interested in what you were saying, which seems to be a theme that keeps coming out from all the online information and all the websites, is how to stay active. Physically active seems to be really important in making people feel alive when they're so stuck indoors. So thank you for that. And that really sort of leads on to my next sort of question, which is that you are very active in the diabetes community in lots of different ways. And I have always been really impressed and touched and honoured to even have a chance to talk to you about that. And you must have spoken to so many patients now, or people with diabetes. What is it that you're hearing from other patients? What are their worries and concerns in relation to diabetes and COVID-19?
Well, instantly there was a Facebook group sprang up COVID-19 and living with diabetes or something. I can't remember its name actually, but a huge number of parents and carers, husbands, wives, friends of people with diabetes joined that. And the anxiety that they have is almost worse, I think, than the anxiety that than what I feel.
Right.
So I think there's a need for lots of support for parents and carers of people with diabetes, especially around, because we're labelled every day on the news as the vulnerable group. Yeah. So, everybody is super, super anxious about that. And one of the big fears that's been around for many, many years is of going in hospital when you've got diabetes, because we hear a lot of stories about, to be quite frank, poor management of diabetes in some generalist wards if you don't have a good DSN or a good diabetes doctor looking after you. So many things go wrong, and a lot of clinicians' basic training on diabetes is, it was done years ago and they've forgotten it when you turn up with an insulin pump and a CGM monitor. And I actually watched a friend with type 1 die just before Christmas in hospital, very close to me. He wasn't that close, but the hospital was close. And I saw really how poor his diabetes care was. He had cancer, so he was going to die. But, there's a lot of anxiety about feeling that our diabetes will be well managed in hospital. And the other thing I've noticed online is another frequent occurrence, and that's fear of DKA and how to manage it. And a lot of people, have never been seriously ill. And if they were to get this virus, what about DKA? Everybody thinks it's going to kill them, but it doesn't have to. There are things you can do, and there is preparation you can do. And also the fear of hypose. There are things you can do there. You just have to do your best and get the education you've got to manage it.
So you've made some really important points that if I try to distill, one is that if you've got diabetes, what you're hearing from your colleagues, your peers, the diabetes community, is that if you've got diabetes and you had to be admitted in hospital, you've already got a background of insecurity that will the hospital understand my diabetes in the first place? And you're saying that will this get worse with COVID-19 because there are less diabetes doctors and nurses around and everybody's focusing on COVID-19? So I think that's a really important point to highlight, that this is a background fear. And then you make the point about having DKA in the context of COVID-19. Some people may never have had DKA up to this point, and whether that will also be managed carefully and attentively. So I think what you're saying is that a lot of people with diabetes have these insecurities and concerns about whether their diabetes is understood, and COVID-19 has actually made that worse for some people. Is that right?
Absolutely.
Yeah. So I think that's really helpful that you share that, and I'd be really interested in what our the people on the web chat function are also saying, because this is something that we could feed back to the diabetes health professional community, and we can perhaps get in future seminars some diabetes doctors to give a talk to say that actually this isn't true. We're actually really got elevated concerns for our diabetes patients, and this is what we're doing about them. So I'd like to move on to asking you, so you've given me and us some of the more negative or the more worries and fears that people have. Perhaps you've come across people who've described more positive experiences towards their diabetes. Has anything good come out of COVID-19 from a mental health point of view and living with diabetes?
Yes, well, first of all, the fact that, people I know with diabetes have recovered. And, there are quite a lot of them online that I've chatted to, and they've all come through it. So that's fantastic. It doesn't mean that this is a death sentence for us because we've got diabetes. The other huge benefit is the online buddies. Again, for people who have the internet, there are hundreds of groups you can join and forums, and the support there is outstanding, and you can have someone to chat to literally 24/7. And I've seen so much love shared there between people who've never met but actually know each other intimately through online diabetes groups. and that's fantastic. Another a personal thing for me is a gratitude that the sort of taboo subject of end of life is, will gradually be talked about more and more. And I think that's a big benefit for the whole of society and not just the people with diabetes. A couple of things I've personally got involved with in the last few weeks. One of them is for people with type 1, and it's the ARTIST programme, ART1ST. So it's a celebration. A group of people with diabetes have got together with some clinicians, and we're every day posting on social media examples of people's creativity. So them playing music, reading poetry, their paintings, their photography, doing a dance, anything artistic, their knitting, their crochet. And we're encouraging people to send all that in so that we can all get to know each other through artistic talent. I am a musician by training and I adore music, so I've really enjoyed volunteering for that. And then the other thing to say on that is that volunteering actually gives far more than it takes away. And that's one reason why I've been volunteering so much for the NHS and diabetes charities in recent years. It is so rewarding. And I read this morning that 750,000 people have signed up to the NHS volunteering programme. And even if you're stuck at home and you can't go out, there are jobs you could do to help the NHS. So I'd recommend anybody who's now got time signs up to that. And then finally, something that's given me a lot of laughs and a lot of enjoyment is signing up to Gareth Malone's Great British Home Chorus. 300,000 people, singers and people who can't sing, have signed up to that, and it's half an hour a day at 5:30. And Gareth is so funny and he's so brilliant, and it doesn't matter even if you can't sing. You just log in for half an hour, and boy, it just makes you want to dance with joy. We sung Elton John and goodness knows what, Duran Duran. It's just really great fun, and that's a huge positive. 300,000 people around the UK and abroad all singing together online. I mean, what could be more fun than that?
Thank you for that, Liz. I actually looked at the artist website, and it is really great fun looking at so much variety and creativity. And I'm going to tap in onto the music as well. And but I'm glad nobody will have to listen to my voice. So can I ask you also, have you come across people who are living alone with diabetes?
Is now exiting.
What do they say, and how best we as a diabetes community should be supporting them?
Yeah, I mean, clearly loneliness is a huge thing for all of us, whether we live alone or not. We miss our friends and our colleagues and our, chats with people. A huge fear for people on their own is hypos at night when there's nobody there to help them. I've been long campaigning for better access to clinical continuous glucose monitors for people, and far fewer people get access than actually qualify for it. There are very strict criteria, but I would encourage anybody who does have hypos at night to actually get in touch with their team, collect your data so that you can show that is the situation for you, and see if you can get access. But the fear of hypos and the fear of DKA are huge. And then there's, a lot of fears around access to regular checkups and complications. So, our foot checks going on, our eye checks, retinal screening going on. There is a Diabetes UK care line you can phone up, and they will give you information about that, and they can check what's still running and what isn't running in your area.
Right, okay. No, that's really helpful. I think that's really important what you say about the fears of DKA and of hypos. And whilst some people may have the technology, what would you advise those that don't have the technology to monitor their blood glucose and yet still live with the fear of hypos? I agree with you. I think in my clinic that's a recurrent theme that's often almost like constantly there as the background fear.
Yeah, I mean, it's just a matter of paying a lot of attention to your diabetes management, sadly. And it's something we all hate doing, who wants to be thinking about that all the time? But you've just got to monitor, if you've got access to test strips, use them. If you don't have access to test strips, you can test your urine. If you have type 2, you won't have access to test strips. And your hypos might be less frequent, depends what meds you're taking, but you can still have a fear of it. And the only way of managing is by eating carefully and trying to balance your medication and taking care when you take a lot of exercise.
But I guess that people who really struggle with accepting their diabetes or are very depressed about their diabetes, we're asking them to do things that they really resent doing, aren't we? We're asking a big leap of faith in believing that this is worth it. Yeah,
I mean, I went through years of that, as I was a teenager and in my 20s, and my eating behaviour was crazy, and it did literally take me years to sort that out. But I read a lot about psychology, and now we have access to all these online apps for meditation and stuff like that help you come to terms with stuff. But there is no way around it other than to dig deep and find the courage and get the motivation and be determined. You've got to be quite strong to help yourself get better without support. But nowadays there's so much available online that can help you do that. And people like me and other people who've actually grown through those struggles and feel able to face them now. There are a lot of people there to help, but actually finding the motivation to ask and to dig deep enough to really look at yourself and face those fears is no easy task.
No, and I think it's really good that it's really important that you say that what we're asking people who are struggling with looking after their diabetes, especially in this time, that we acknowledge it's difficult for you. And, we're not saying things like pull yourself together and sort it out. We know it's difficult, but it is somewhere in you. That's what you're saying about yourself, isn't it? Yeah. You found it. You found that wish to live. The glimmer of hope, and you stuck with it, and you persevered, and you basically sounded like you were gradually building your confidence, even though it took a long time. You built your confidence to a point which you could change, and you're saying it can be done, and I think that's right. I always believe that everybody can change up to the point that one leaves this life and dies. So I think it's a really good message that you're giving us. I'd just like to finally ask, there's a lot of research going on about cures for COVID-19, testing for COVID-19, even the medical aspects of diabetes and COVID-19. From a psychological point of view, in the context of diabetes, what do you think would be good research questions that we could be studying right now?
Well, I was really thrilled a week or two back to see that Diabetes UK has already put a call out for researchers. So, thank goodness, and that's very, very fast to turn around an idea into a research project. But the other thing I've been doing, again, this literally takes seconds a day, but I saw on TV that there's an app being developed called COVID-19, and it does ask a lot of personal questions when you sign up about your health status, but it is totally anonymous. You just tick a few boxes, and it takes seconds a day to report, are you well, are you not well? And if you're unwell, what are your symptoms? And I've also seen on the BBC that in the news that they've already, in the space of 10 days to 2 weeks, discovered information from this, helpful information that's helping them learn about COVID. And I just really recommend that anybody healthy or with diabetes, well, we're healthy with diabetes, but anybody of whatever their health status, to sign up and do that, because it'll help researchers. And I'd just like to say something in response to your reflections on the previous question, is that if you're feeling burnout, it will pass. I've been in that space many times. It does pass. It will pass. So don't feel that all is lost.
Yeah, please don't. I mean, I've had some patients in my clinic who've used COVID-19 to help them reappraise their life values and what they want to do. I was really touched by a patient last week who said, actually, I do want to look after my lungs. You know, I do want to know what, you know, he's a young person in his early 20s and say, I do actually want to know what my life will look like. I don't want it to be shortened, and has used the experience of COVID-19 to reappraise his values. And I've had a few of these patients in my clinic, which is a psychiatry clinic. So I think there could be some positives for some people. So thank you very much, Liz. I'm going to stop asking questions right now and hand over to Rebecca and Emma, who will read out some of the questions. But would you be okay to stay online so that we can have a discussion about some of the questions that come through the chat function?
Sure.
Thank you. So Rebecca, would you like to start reading out some of the questions?
Sure. Thanks so much to everyone who's posted their question on here and sent us messages on Twitter also. So I'll try and summarise a few. There's been a couple, Khalida, around how do you manage the negative emotions associated with, you know, glucose levels going all over the place in the last few weeks because lifestyle has changed. We're all, you know, isolating, staying in one place. And also the fear that, you know, blood glucose might change if we get COVID-19.
Okay. So I'll start off perhaps and then ask Liz. First of all, I think let's think about what Liz said, which is articulate your negative emotions. So that's fantastic that you have done, and perhaps write them down. And then when you write them down in the context of your high blood sugars, have a look at them and think about what your thoughts are around those emotions. So you're something like I'm anxious, I'm frightened, I'm fearful. Those are what we call emotions. And then think about what your thoughts are, which are your cognitions, which is I'm scared I'm going to die. I'm scared that this blood glucose is going to go really high and I might get admitted and nobody will know me. I'll be abandoned because you think that everything is stretched. So then try to, what we call in one type of psychotherapy called cognitive behavioural therapy, we try to now rationalise those and try to find alternative thoughts. So that thought, I'm going to die, or I'm going to be rushed into hospital, or my diabetes is going to get into worse. What could be an alternative and more constructive or more helpful thought? Because the way to think about it, you've had a negative thought. Is it possible to have a positive thought? And your brain is yours, so you can make your brain and your mind think whatever you want it to think. So you can turn around and find a more constructive thought. Be interested in the web chat if you want to reply. Because if I tell you what constructive thought would be, I would be cheating and it wouldn't be yours. So that person these people who sent that question, it'd be great if they actually replied in the chat function to say, okay, these would be my alternative, more constructive thoughts and feelings. And it'd be great to hear from Rebecca if some people have actually replied and said, yeah, I did think about this and I've come up with a different thought. Liz, what would you say?
Well, I think the second half of what Rebecca just said is people are afraid that if they do get it, their blood glucose is going to go all over the place. Well, it's the basics really. There are online courses you can do about managing your diabetes, about sick day rules. And it freaks you out as soon as they start going high, and then they bounce low and they bounce high and low, and it goes into that sort of roller coaster. But if you know the rules, if you know, revise the sick day rules, look at everyday management, try your best to manage it as well as you can, before you get ill, not just when you get ill. So again, it's preparation. And I've got the benefit of, 55 years of doing this. But if you're newly diagnosed, that is challenging. But it does mean that you've got to spend some time. If you haven't done Daphne or you haven't done Bertie or Expert or whatever course, do it online now. Try and get that under your belt so that your fears lessen. There are practical steps you can take to lessen fear. And often we know inside ourselves, if we're honest, what those are. But it's just actually then doing something about it.
Excellent, thank you, Liz. So that would be an alternative thought, isn't it? Is there something I can do about these high blood glucose levels? Let me go and find my sick day rules list that my diabetes team sent me. So that would be an alternative thought, is instead of being scared that I'm going to die or something horrible is going to happen to me, can I do something about these blood glucose levels? So I think it's thinking, what can I do about it? What would be a different way of thinking about it? So thanks, Rebecca. Are there any others?
Yeah, this one's quite interesting for you, Khalida. How has COVID-19 impacted your clinical work, and do you think it's going to change things, long term?
So thank you for that question. We've converted nearly all of our work into virtual clinics, and we have found it to actually be really, really effective. We've admired our patients who sometimes struggle to meet us in clinic face to face, often because they're poor, often because they're depressed, and therefore it's hard for them to make that effort. But actually we have found that most of our patients have been responding to our phone calls, setting up the meetings and attending the virtual clinics. And we are a bit privileged that we know the patients already, so speaking to them online or on Zoom has been quite effective, and actually they have really valued our support. So even though we're not on the front line, a lot of people with diabetes are really finding it helpful that we're staying in touch with them. And actually with some of our patients, we've been able to move on a bit further than we would have thought, because they have used COVID-19 in a way to think, well, what have I got? Was it worth it? What have I got as resources, both informally and formally, and should I be treasuring them rather than taking them for granted? So I do think Liz is right that we are looking at our lives in a different way. The idea that we might die, but the idea that we've actually got lots of good things around us and good people around us.
Yeah, that's really interesting. I think, Emma, you had a couple of questions as well?
I do. So there was a very interesting question that popped up in the chat. How can you manage fear when you have type 1 disordered eating, knowing that the A1C is already raised and putting yourself at risk?
Yeah, so I think Liz and I can answer that, but maybe if Liz starts.
Whoa.
Oh, sorry, you don't have to. I can start.
You start and I'll reflect.
Well, thank you for that question, because it is actually, a fundamental, core and deep problem, because you've got your high blood sugar levels. You sort of want to get them down because you want to have better health. But at the same time, you're concerned that if I do, I will put on weight. And so you've got an ambivalence, haven't you? You've got at one level you want to stay well and be well, and another, but that you think comes at a price of putting on weight. So managing that fear, I think thinking again, and I've got no problems about repeating what Liz says, is acknowledging that you are scared is the first most important thing, and perhaps writing it down, sharing it with your loved ones, and actually also speaking to your diabetes team. I think we need to emphasise that the diabetes teams are still open for business, but you might need to speak to them over the phone rather than in the clinic, and so is your GP. So actually the fear, and then what you have to do perhaps is to think about how you're going to weigh up what's most important to you, and whether you're willing to experiment and try a little about being different. So if you are scared with your disordered eating and having diabetes, ask yourself, what little bit am I prepared to do that is a little bit different? Nobody's asking you to start taking all of the insulin all at once. Although we'd like you to, we're not going to ask that of you, because we know that will make you very anxious. So perhaps you could think about, could I take just a little bit extra, just one extra few units perhaps of insulin, as one step forward into trying to get better health, and to think of it as an experiment, and to think, can I actually manage that? Can I manage my feelings? And also, if you've got very high HbA1c and you would like help, you should try to contact your GP or your diabetes team, because there are actually, experts around now and mental health experts who may be willing to talk to you. So please don't give up, and think about contacting the health professionals for advice. But in the meantime, think about ways around this way that I've suggested of you addressing your fear. Liz, would you like to build on that? Or?
Yeah, that was a brilliant answer. Absolutely brilliant. But, when I was younger, my HbA1c was very high. I didn't even know what it was, but it was very high because I overate a lot. And I've noticed online a lot of people are comfort eating now and finding that really challenging. But what you said is absolutely perfect. You've got to find that tiny bit of yourself that's willing to look at it and address it. And now there's so much information available online. And again, to reiterate what you said, I had a consultation with a GP. It wasn't my own. He didn't even know me. But I had that just over a week ago about something else, and it worked. They are there for you. They were there for me. And I know my consultant is online if I need to email him. And I think we just have to take comfort from that. And that to me is hugely comforting, because the thought of being on my own, totally on my own with my diabetes is really scary. I really need my diabetes team. But, they are there for us. Reach out if you need it.
And I don't know if the person who sent that question was a patient or a health professional, but I'd be very interested if you felt the confidence to ever say, I did try a little bit and wanted to send a message to Twitter and let us know how it went. We are in a new world where virtual support, although I cannot provide you the clinical advice, the virtual support is also getting feedback if you found it helpful. So let us know if you want to. Okay, thank you.
There is another question also around fears. I don't know if the answer will be similar, but this is about how will you manage fear of not having access to safe foods, whether that is for an eating disorder or if it is about accessing hypo treatments.
Okay, so fears are always the same, aren't they? They're always have two components. Well, three components really. One is the actual anxiety, which is your body reacting. So you will have lots of sensations in your body. And then you have a thought, which is exactly what you've said, which is I won't be able to get hold of my diabetes emergency treatments or the right kind of foods. And then what I'm interested in is, what does the person do with that combination? What is the behavior and what is the decision that the person makes with these fears and these fearful feelings and these thoughts? Is what decision do they make? Do they say, I'm going to try and problem solve, or am I going to bury my head in the sand and get more and more anxious and more and more depressed? So again, no apologies. I'll follow on from Liz's top tip, which is about articulating is always the first step. Sharing it with yourself on paper or with your loved ones or with a health professional, and then thinking about how to problem solve that situation. So moving away from, I can't get hold of my diabetes treatment, to let me try and problem solve this. And again, it's finding that strength and confidence and belief that you can do and solve a problem is what's being required of you. Now, I understand that some people find that really hard to access that bit of themselves, but everybody has it, even if it's a little bit. And so problem solving is a really good way of dealing with these kind of practical fears. So I would say, contact my diabetes team, contact my GP, contact the diabetes online community, contact Diabetes UK, work your way through people and organisations that could help you to solve this problem about foods and about your emergency equipment.
Thank you. And the last question we have is there any way to recognize whether you're experiencing breathlessness or a panic attack?
So could you repeat that, Emma?
If there is any way to understand whether one is experiencing breathlessness or a panic attack.
Okay. Panic attack is, if I go through the basics of what a panic attack is, it's a very, very, very severe anxiety response. And if you think about panic attack in the old-fashioned way of the flight and fright response, of what we all do when we're really scared, and it is your body, your brain has had a fear that something horrible is going to happen to you, and your body reacts to what we call an autonomic arousal. So the adrenaline system gets activated, and your heart starts racing, your lungs start breathing heavily, your muscles get tense, blood gets diverted from your stomach to all of your muscles because you're preparing to have a flight, to run away from the situation, or a fight. So that's why we call it the flight-fight response. So this is a body's natural reaction to when the brain is really scared. And how to tell, so in a way, breathlessness is part of a panic attack. What I think you really mean is, what is the cause of my breathlessness? Is it a panic attack, or is it, I imagine you're thinking, is it COVID-19 or some other disease process? So one of the ways to think about that is to try relaxation techniques, and hopefully I'll be handing over to Rebecca in a minute, and she will be signposting you to a really good app that can help you with relaxation techniques. But you can also do basic things like checking your temperature to see if your breathlessness is related to a temperature. And I think always, if the breathlessness persists, especially in the context of a cough or a temperature, to call your GP, because they are there waiting for you and there to support you. So I know lots of GPs who say we're fielding lots of calls around breathlessness and panic attacks. But I think what you raise is a really good point, and I think we're going to go away and think about it. Think about perhaps creating some more information around how you can separate the two. Thank you. So we're nearing up to the end of our the webinar, and I'm going to hand you over to Rebecca, who's going to go over through some really interesting websites that we've spent time looking at that we think that you might find helpful. Thank you, Rebecca.
Hi everyone. Yes, we've chosen a few this week. Just to note, this is not an extensive list, and we'll share more in future webinars. And also, if you have any resources that you found helpful and you'd like to share, please let us know. So I'm just going to try and share a PowerPoint slide with you so you can see the links, but I'll also share it in the chat and on Twitter afterwards. So bear with me 2 seconds. Can you see that slide?
Yes, that's perfect.
You can see it? Okay, great. I'll just talk you through them quickly. So Liz mentioned a couple of these earlier, but the first one is great for you creative people out there, and it brings together and showcases the talent of people with diabetes, and you can share anything from art, photography, and videos of songs, music, dance, poetry. You know, it's a great creative outlet, so you can express how you're feeling at this time of social distancing, and a great mood lifter as well. So if you want to learn more about how to send your work in, if you follow the website link there, and it's also worth following their Twitter handle, and even if you're an observer and don't want to send anything in, it's good to see the work that's been shared. Moving on to the second one, so this is more for self-reflection, and we want to share Dr. Rose Stewart resources. So she's put together something called the Coronavirus Toolkit, and you can access this via the T1 Resources website. And the resource takes you through things like information on self-isolating when you have diabetes, looking after your mind and making the most of your time at home, managing worry, and how to get to sleep. So it's a really good resource, so let us know what you think about that one. And as Khalida briefly mentioned, one of the apps that we've found useful is the Headspace app, and this takes you through some mindfulness techniques to help with stress, anxiety and sleep. The app's free for NHS workers until the end of the year, and discount for students as well. And there's also a free trial if you want to try it out. So there's other mindfulness apps available too, so please let us know your thoughts if you've tried any of these out. And finally, Liz mentioned this one earlier as well, is the daily YouTube singing by Gareth Malone, and you can access that. You can register on the website and check out his daily videos. And a lot of research says that singing is a great mood buster, so let us know what you think about that one. You've been brave enough to try.
Thank you. And as Rebecca says, this is not an exhaustive list. We'll be building more links with each week, rather than repeating the same ones as we do our own research and listen to the feedback from you. So were there any final points, Emma, Rebecca, that you wanted to raise from the chat group?
No, that's great. Just want to thank everyone who's joined, and please do interact with us on Twitter. Our handle is @KCLDPsych. So just
Unknown participant is now exiting.
Thank you so much, Liz, for joining us. Was there any final comments that you wanted to make about how you thought this went? Do you think this is something that we could build on going forward?
I think it's brilliant, and you know, when it was shared on social media, you could see that lots of people felt it was much needed. I'll be really interested to read the comments, because I've not been reading them as we've been chatting, but be really interested to see what people say, and you know, if I can help to make suggestions about other topics that we can talk about in future.
Would you suggest that it's not always about COVID-19?
Yes, absolutely. Diabetes and mental health, you know, most people can't get anywhere near a counsellor or a psychologist. They can't get anywhere near that service, and would absolutely love to know more about how diabetes affects the mind.
Okay, so that's really helpful that although COVID-19 is in the backdrop, we can actually perhaps focus on other things, because we've all got our own lives as well, as haven't we, that carries on. So thank you so much. Really grateful for your support and involvement in helping to develop this, and look forward to working you behind so we'd like to say look forward to meeting all of you, and also all our new audience members next Thursday, also at 12 o'clock. And reiterate that your feedback is important. This is new arena for us all. And I apologise if sometimes the technology didn't work, or if you thought this hasn't quite met your needs. But if you tell us what they are, we will try to build these in. So thank you, everybody, for your attention, and we'll end the meeting there. Bye.
Bye, thank you.
Thanks.
Bye.
Bye-bye.